Hi, I'm John Gill. I'm the Chief Human Capital Officer for the Department of Health and Human Services, and I'm happy and pleased to be here today to spend a little bit of time and give you some perspective from my standpoint on the whole notion of workforce planning. It might be helpful for me to give you probably the most impactful thing that I've seen in my period here in the federal government, and that is the quality of talent. As many of you know, I've come from the private sector and only been in the federal sector for a short period of time. And the quality of talent that exists in the federal sector is as good as any that I've seen in any of the corporations that I've either been part of personally or affiliated with in the private sector. And when you begin with that kind of core, there's some tremendous things that can happen. The second thing I would say is that there are some tremendous pockets of great ideas being executed across the varying operating divisions. I've had a chance now to visit about 10 to 11 of those within Health and Human Services. And there's some great work going on, not only in the leadership area, but equally so in some of the various performance-related activities in these businesses. And the work that's being done from administration to clinical science to real medical breakthroughs is extraordinary for me to see. What I would also say is that whilst we have many of these things going on, we need to get better at sharing those great practices with each other. And that's something I want you to take away from this. But I want to concentrate now on the specific issue of workforce planning. You know, as I've said, I've been to about 10 or so of the operating divisions right now and the staff divisions. And the one area that really was quite intriguing to me when I came in was this notion of mission-critical occupations. I'm quite familiar with the notion of mission-critical occupations in the private sector, and we would call them key essential positions or critical positions. And what it was really about was, in some cases, senior leadership or key positions for leaders, but oftentimes it was a set of competencies that really distinguished you in the competitive environment in which you were playing and gave you a competitive edge in that particular environment. In our case, it really has to do with those mission-critical positions that really drive the science and technology and overall mission success of the operating divisions across HHS. And they're really quite powerful. And so as I went around, I would ask a series of questions because I wanted to understand it more deeply. And my first assumption was that because they are mission-critical positions, there has been deep thought gone into establishing them as such. And so the first question I'd ask is, do you have mission-critical positions or targeted occupations, as it's sometimes called? And the answer invariably would, yes, we do. Easily able to identify by title the various ones that would be appropriate for that particular division. The second question I'd ask was around, well, how are we today? And there would be a bit of a pause, and we would get into a conversation around the number of open positions that were still out in the marketplace to fill, the needs that weren't being addressed today, the need to immediately and quickly fill those positions. Certainly that's an appropriate part of a response for the question that I asked. And clearly we need to be addressing the tactical here and now requirements that exist. But the third question is the one that I want you all to think about, and that is, how will we know when we're fully mature and capable in that mission-critical occupation? And that's a different question. And it's not about today, it's about the future. So as an example, today we have a position, for instance, in information technology. It's certainly one of our mission-critical occupations. And we equally have mission-critical occupations in the clinical area. Now today, when you look at the world and you look at our role profile and position description, they sit in different series. Yesterday, I was in a conversation with a number of CIOs from around HHS, and the discussion came to be around the idea of clinical informatics. Now, I had not heard this term before, and many of you may be familiar with it, but what it was about was the fusion of technology and real clinical experience in the future healthcare system that we're going to, and the need to begin to develop that capability, not only for now, but for 5 to 10 years from now. And if you think about technology and you think about what it's doing in our world, in the healthcare delivery system environment that we're going to in the United States, that begins to make sense. And so my message to you is you must talk to your leaders about what the future looks like from a performance standpoint and a capability standpoint, not just what we have today. And when you do that, it opens up a whole bunch of different opportunities, because once you begin there, you're now looking at tying some different strands together. So I want to talk about my view of our resources. I think we are replete with appropriate types of resources to use to be able to put a whole system together. And here's what I mean by that. When you look at the work that's already going on at the middle and high school level with science, technology, engineering, and math programs, and you then move up into the internship programs that we have through Pathways at the university level, and then you lay in the amount of directed research that we're doing in these universities in many of the sciences and medical areas that are important to us in the long term, and you consider beginning the conversations with these universities and even the high schools about the kind of skills that we need for the future based on what our understanding of them is, just as I just described about clinical informatics, we then begin to harness those number of things that are already going on in a coherent way. And if we started doing that just in this mission critical occupation area now, and began to position ourselves today with the right kind of roadmap for the future, 10 years from now, for those of us who have moved on and become private citizens again, will look confidently on what has occurred here in HHS and feel really good about the total capability that we have in these areas.